Knock, knock, knock. Hi, my name is Fiona. I'm going to be your nurse today, or your nursing student today. I'm going to be doing a respiratory exam, so I'm going to be palpating, doing a general visual exam, as well as listening to some respiratory sounds on your chest and back. Is it okay if I videotape you today?
Yes.
Okay, wonderful. I'm also just going to check your first and last name and your date of birth. Would you mind telling me that?
Rose Espinal, 04/13/2002.
Perfect. Thank you so much. All right, and then I am going to go ahead and take a look at skin areas and head. Skin appears to be symmetrical. I'm not seeing any lesions or bumps, bruising, and patient alert, sitting upright, no signs of distress, no overt skin color changes, and grooming and hygiene seem to be intact. Okay. Next, I'm going to do some vital sounds. So the first, I'm going to just ask if you're having any pain anywhere today.
No, no pain.
Okay, great, thank you. And then I'm going to go ahead and do your radial pulse. Okay. Okay, wonderful. Your radial pulse was in normal range, which is 60 to 100. And then I'm going to go ahead and check your. Okay, now I'm going to go ahead and complete some vital signs. So the first one I'm going to go ahead and do is assess pain. Are you having any pain today on a scale of 0 to 10?
No.
Okay, so
0.
0? Beautiful, thank you. And then I'm going to go ahead and check radial pulse, as well as your respiratory rate. So if I could just have your wrist, thank you so much. All right, wonderful, thank you so much. So your respiratory rate and your radial pulse, or your heart rate, are within the normal ranges, which are 60 to 100 beats per minute, or 12 to 20 beats per minute in regards to your respiratory rate. Then before we get started with the rest of the exam, are you having any chest pain, dizziness, palpitation, shortness of breath, or cough? No? Beautiful, thank you so much. Okay, now I'm gonna go ahead, next I'm going to inspect the neck and anterior thorax. I'm going to take just a quick look here if you don't mind. Okay, all right, and what I'm observing here is I'm observing symmetric coloring. I don't see any lesions. And skin does not seem to have any breakdown or open areas. Skin seems symmetric in coloring, no lesions, skin intact. Wonderful. All right, moving on. I'm gonna check your breathing pattern. Okay. Effortless and non-labored regular breathing patterns were noted. Then I'm gonna go ahead and inspect the tracheal deviation, or the trachea midline. Okay, trachea seems midline, and then I'm gonna go ahead and take a look at your shoulders. All right, great. They are symmetric in the rise and fall of your shoulders. Then I'm gonna look for chest retraction. Take a deep breath in and out. Wonderful. Okay, I do not see any chest retractions. And then I'm taking a look at your thoracic cage, which is clavicle, sternum, and rib cage, for any MSK deformation. So I'm just gonna go ahead and take this off. And I'm just gonna pull this one to the side just to take a quick look. Great, I'm not seeing any MSK deformation. Thank you so much. Okay. I'm just going to go ahead and palpate the bony structures of the thoracic cage for tenderness or masses. Okay, no tenderness or masses were noted. Okay, now I'm going to go ahead and do some auscultations of the anterior thorax. So I'm going to go ahead and put the stethoscope right onto your skin if you don't mind, okay? And then I'm going to go ahead and, I'm just going to go ahead and lift the gown this way if that's okay. Great, thank you so much. Okay, you have clear BV and V lung sounds. Then I'm going to go ahead and move to the posterior thorax. All right, now I'm going to be moving on to my part of the exam where we're going over the inspection, the palpitation, percussion, and auscultation of the posterior thorax. So first, I'm going to inspect the shape of the thorax using the anterior, posterior to transverse diameter, or the AP/T. And that appears to be 1 to 2 as expected. Then I'm going to go ahead and take a look at the skin of the back. Skin is symmetric in coloring, no lesions are noted, and skin is intact. I'm now going to inspect bony structures. Okay, so no MSK deformities noted. And go ahead and take a deep breath in and out for me. Wonderful. All right, then I'm gonna go, so with that, I noted that there was a symmetric rise and fall of the scapula. All right, wonderful. Now I'm gonna go ahead and palpate the posterior thorax. So when you feel my hands on your back. I want you to go ahead and say 99 for me, okay?
99, 99, 99, 99, 99.
Great, thank you so much. Bony structures are without tenderness or masses. There is a plus symmetric expansion and the tactile fremitus equal bilaterally. I'm gonna go ahead and now percuss. You're just gonna feel a little bit of tapping on your back, okay? Okay, so resonance noted in all lung fields. Now I'm going to go ahead and listen to some of your lung sounds on your back. You're just going to feel my stethoscope. Okay, clear B, B, and V lung sounds noted. And with that, we are all set with your exam today. You are all set to be done. Do you have any questions or concerns for me?
No.
All right, wonderful. Thank you so much.